the day before she passed away, she was just in a constant state of confusion and restlessness and just constantly wanting to get up. And so a couple of nurses came in. One of them started praying, and the other one started praying. And it was just probably one of the most precious things that I've been a part of. And it was, right after that, she calmed down and passed away the next day. But those kinds of things you'll never forget. And this place will always have a special place in my heart for the rest of my life.
Shepherd's Cove Hospice is the only local nonprofit hospice serving Marshall County, as well as the 8 surrounding counties. It offers a compassionate and philosophical approach to end-of-life care for people, regardless of their ability to pay. Its reputation for superior quality and personal level of care are unmatched. Yet Shepherd's Cove Hospice can do more to meet the growing needs of the community.
With all the changes happening in the national healthcare system, Shepherd's Cove Hospice has to pursue several objectives to ensure its existence for future generations.
Through the Vision 2020 campaign, Shepherd's Cove Hospice is working to secure its past, present, and future by reducing its debt, expanding programs, and building a preservation fund.
Built in 2007, Shepherd's Cove Inpatient Unit was constructed with the assistance of a $1 million federal grant. The grant required that construction begin almost immediately. So, Shepherd's Cove Hospice borrowed $3.3 million and, with other funding, built the only inpatient hospice facility in North Alabama.
Shepherd's Cove Hospice currently pays $21,714 each month toward this debt. A balloon payment of $1.25 million will be due in 2022. The short-term consequences of the monthly payments already hinder its ability to reinvest in the community. If these payments can't be met, SCH would have to consider refinancing, risking future sustainability, or be forced to merge, losing local control and its nonprofit status. Retiring the debt is critical to SCH's long-term security and ability to thrive, as well as the community's ability to access superior hospice services. A successful campaign will allow Shepherd's Cove Hospice to introduce new programs and expand current ones to meet the growing needs of its service area. Many community programs will be impacted, including palliative care, perinatal hospice, and Camp Hope.
So if you stay calm, what do you think he's going to do?
One new initiative is palliative care. Currently, if you have a life-limiting diagnosis but choose to continue curative treatments, you are not eligible for hospice care.
Palliative care was designed to help bridge the gap in health care that exists for families that are dealing with serious life-threatening issues. They can at the same time be receiving very aggressive curative treatments.
Palliative care includes outpatient care with in-home oversight. This model focuses on increasing the quality of patients' lives as they fight serious illness. No other agency provides this service. Another new program is perinatal hospice. This care addresses one of the most tragic circumstances, the loss of a newborn child.
Prenatal testing can lead parents to discover that their child has a life-threatening condition. This is a devastating experience and they need tremendous support.
Perinatal hospice helps parents cope with and accept their path by walking with these families through the pregnancy, birth, and death while honoring the child and their family.
In March of '09, we found out that we were pregnant. In early August, when we thought that we were going to get to find out the sex of the baby, and we got the news that something was not exactly right with the baby. A few weeks later, we actually got the diagnosis that he likely would not make it to term, and if he did, he would not live very long at all. One of the biggest things that I'm excited about a possibility of having a perinatal hospice is the fact that it validates that there really is a baby. You know, it's not just something that's not working out, that it is an actual person, it is a baby, it has rippling effects.
Shepherd's Cove Hospice will also expand bereavement services, including juvenile and in-school bereavement, the Employee Assistance Program, Workplace Crisis Intervention, and especially our Camp Hope program.
So in talking to her, were you maybe reassuring her? So what about maybe reassuring each other?
This unique equine-assisted grief support program helps children dealing with a loss learn to express their grief and develop coping skills.
When I think of Camp Hope, the best example I can give of what happens out in the arena and the relationship between the horse and the students is I'm reminded of a story when a young girl who experienced the death of her mom was grooming the horse.
Just like you like to be cared for, they do too, okay?
She walked up to her facilitator and whispered to her that she remembered her mom brushing her hair the exact same way when she would get up and get her ready for school. So it's intimate stories like that that we hold dear and really feel blessed to be able to honor the memory of the loved ones that the kids are coming out to Camp Hope in memory of.
The Affordable Care Act has resulted in a downward trend in reimbursements for Shepherd's Cove Hospice, which, as a rural hospice, already has the lowest reimbursements in the country. There is also a growing number of local indigent patients who do not meet the requirements for Medicare or Medicaid and cannot afford care.
Shepherd's Cove Hospice has never turned away anyone who needed our care, but that can be a challenge. We have to be good stewards of our funding.
It is essential to create a preservation fund for Shepherd's Cove Hospice to ensure that, in the long term, it remains a secure and locally managed organization. This fund will hold around 3 months of reserves, cash that can be used as needed to account for slow-paying insurance or government programs, as well as indigent care. In order to accomplish these critical objectives, Shepherd's Cove Hospice launched Vision 2020 as a strategy to raise a minimum of $3 million to provide community support by the year 2020. This campaign is vital for the community. When a family is facing the loss of a loved one, Shepherd's Cove Hospice will be there to offer needed support and care.
Anytime there was a need, all we had to do is call and they were there, and so it was very professionally done and very competent.